Hi, my name is Brandon Scoggin, and I'm a student of physical therapy at the University of St. Augustine for Health Sciences. Today I'm going to be talking to you about the social determinants of health and specifically how they can influence an individual with type 2 diabetes. Let's dive in. We'll be looking at the Kaiser Family Foundation model that uses the 6 social determinants of health that are economic stability, neighborhood and physical environment, education, food, community and social context, and the healthcare system. First, we'll look at economic stability. This includes employment, income, expenses, food security, and insecurity that an individual might possess. Low income or unstable employment may delay care due to cost. An individual with type 2 diabetes might even ration their insulin because of the cost. This also can include delayed care that an individual might have. Next, the neighborhood and physical environment. So this includes housing, transportation, safety, parks, and even walkability of the neighborhood. Now, an unsafe neighborhood or lack of walkable areas may reduce physical activity and in turn lead to a sedentary lifestyle. Also, poor housing can increase stress as well as the unsafe neighborhood. This also could lead to conditions such as asthma, which could reduce physical activity even more. Next, we'll look at education. This includes literacy, language, early childhood education, and higher education. This could possibly reduce understanding of disease processes, medications, nutrition labels, or even when to seek help if an individual had a low education. This could lead to poor disease management, especially for individuals with type 2 diabetes. In the food determinant of health, this includes hunger and access to healthy options. For instance, if individuals live in a food desert or swamp, this could severely limit their access to healthy options. A food desert is where you have limited access to fresh produce and healthy options for nutrition, whereas a food swamp, it's an abundance of unhealthy food options, such as fast food. A poor diet can severely worsen type 2 diabetes conditions. For community and social context, this includes social integration, support systems that an individual might have, and even discrimination. Stress from discrimination, lack of social support, or isolation can elevate cortisol levels and reduce motivation for self-care. This also can reduce adherence to physical therapy. With the healthcare system, this includes health coverage, provider availability, and quality of care. If an individual has limited insurance, there may be provider shortages in their area, and even culturally insensitive care can deter engagement with the healthcare system. Now we'll look at the clinical outcomes for each determinant of health. For economic stability, they might not be able to afford insulin or the care that they need, leading to poor glycemic control. This can lead to higher risk of different complications such as neuropathy, loss of vision, or even amputation. For neighborhood, it could be unsafe to exercise, leading to a sedentary lifestyle and therefore increasing insulin resistance. For education, they might misunderstand disease management, leading to inconsistent self-monitoring of their insulin levels and misunderstanding of medication instructions. For food, reliance on high sugar processed food can lead to a diet that is high in sugar and fat, and that can worsen their glucose control, raising their A1C and leading to cardiovascular risk. For community, isolation reduces motivation. This could lead to emotional eating, which goes back to the food category with their diet. A lack of family or peer support can limit accountability that an individual might have. And last but not least, the healthcare system. If they have delayed diagnoses and fewer checkups, that can lead to late-stage complications and higher mortality. In summary, the social determinants of health can create systemic barriers that worsen health outcomes. Effective care must address more than just the symptoms. and type 2 diabetes outcomes clearly reflect the impact of social determinants of health. Thank you for your time, and here are my references.